1. Which of the following best defines the primary role of a certified medical transcriptionist, CMT? To diagnose patient illnesses based on audio dictations. B. To transcribe, interpret, and edit healthcare provider dictations accurately and confidentially. C. To provide billing and coding for medical records. D. To create patient discharge summaries based on nurse reports. 2. In adult learning, which principle is most relevant when mentoring a new transcriptionist with years of prior administrative experience? A. Emphasizing rote memorization. B. Encouraging self-directed learning and peer collaboration. C. Restricting learning to manual transcription exercises. D. Minimizing learner input during training. 3. Which is the most effective evaluation method for assessing transcription accuracy in a CMT training program? A. True or false quizzes. B. Practical dictation assessments with measurable error scoring. C. Oral recitations of terminology lists. D. Group discussion reflections. 4. What is the most critical legal compliance issue for medical transcriptionists? A. Use of voice recognition software. B. HIPAA privacy and confidentiality of patient data. C. Timely submission of transcribed reports. D. Adherence to formatting preferences of each provider. 5. When mentoring a trainee, what feedback approach best supports adult learning principles? A. Delivering only positive comments to build confidence. B. Offering immediate, specific, and constructive feedback. C. Waiting until the end of training to evaluate performance. D. Comparing trainee errors to those of other students. 6. Which skill is essential for ensuring consistent report formatting across multiple transcription platforms? A. Keyboard speed. B. Mastery of word processing templates and macros. C. Ability to memorize report content. D. Dependence on automated editing software. 7. Which element should always be verified in a dictated report before final submission? A. Physician's accent. B. Report's font type. C. Patient identifiers and demographics. D. Line spacing consistency. 8. Which mentoring technique helps increase a trainee's critical thinking in transcription? A. Providing corrected transcripts without explanation. B. Encouraging the trainee to self-correct using a reference guide. C. Limiting the trainee's autonomy. D. Assigning repetitive identical dictations. 9. Which document is most likely to contain dictations related to surgical procedures? A. Pathology report. B. History and physical report. C. Operative report. Radiology report. 10. Which component of curriculum development ensures training relevance for working professionals? A. Aligning content with current industry standards and certification objectives. B. Designing lessons with minimal practical application. C. Avoiding updates to older terminology lists. D. Focusing solely on theoretical transcription principles. 11. In medical transcription, which error could result in a critical patient safety issue? A. Misspelling the physician's name. B. Incorrect drug dosage entry. C. Inconsistent line spacing. D. Missing punctuation in the header. 12. When evaluating transcriptionist performance, what metric best measures speed and accuracy together? A. Words per minute only. B. Lines transcribed per hour with accuracy rate. C. Time spent on corrections only. D. Number of reports completed per day. 13. Which is a key principle of ethical transcription practice? A. Sharing medical records for peer review without authorization. B. Maintaining strict confidentiality of all patient information. C. Editing reports for brevity by removing minor details. D. Discussing patient cases during team meetings. 14. Which learning strategy supports adult learners in mastering complex medical terminology? A. Repetitive drills without context. B. Case-based transcription exercises. C. Timed recall quizzes only. D. Passive lecture-based instruction. 15. What is the primary purpose of the QA quality assurance process in transcription? A. To monitor equipment performance. B. To evaluate and improve transcription accuracy and consistency. C. To schedule transcribers' shifts. D. To design new report templates. 16. Which regulatory guideline governs data security for transcriptionists working remotely? A. Occupational Safety and Health Administration, OSHA. B. Health Insurance Portability and Accountability Act, HIPAA. C. Food and Drug Administration, FDA. D. Centers for Medicare and Medicaid Services, CMS. 17. Which of the following most accurately defines discrepancy in a transcribed report? A. A formatting inconsistency. B. A mismatch between dictated and transcribed data. C. A missing timestamp. D. An unclear physician accent. 18. In adult education, which factor most enhances retention in transcription training? A. Passive observation of mentor work. B. Immediate application of learned skills to real dictations. C. Delayed feedback on assignments. D. Rigid, instructor-centered delivery. 19. Which skill is critical for ensuring medical legal accuracy in reports? A. Data entry speed. B. Knowledge of medical nomenclature and context. C. Audio file management. D. Familiarity with administrative workflow. 20. A student consistently misinterprets abbreviations. As a mentor, what is the most effective corrective strategy? A. Assign extra transcription workload. B. Review abbreviation lists with context and examples. C. Ignore errors until final assessment. D. Recommend termination from program. 21. What is the primary communication skill required for effective collaboration between transcriptionists and healthcare providers? A. Use of professional and concise clarification requests. B. Frequent casual communication. C. Providing verbal feedback during dictation. D. Delaying queries to avoid interruptions. 22. Which phase of curriculum design involves mapping objectives to evaluation tools? A. Needs assessment. B. Alignment and integration. C. Implementation. D. Feedback collection. 23. Which of the following transcription errors would be categorized as critical? A. Missed comma. B. Omitted medication name. C. Incorrect page numbering. D. Inconsistent spacing. 24. When designing a medical transcription training module, which step ensures alignment with certification standards? Reviewing the official CMT competency framework. B. Relying on outdated dictation samples. C. Avoiding reference to test objectives. D. Allowing learners to choose topics randomly. 25. In mentoring a transcriptionist struggling with medical spelling accuracy, what intervention is most effective? A. Encouraging the use of medical spell check software combined with context review. B. Requiring retyping of reports without correction tools. C. Focusing on grammar only. D. Ignoring spelling errors to promote confidence. 26. When assessing student performance, which tool best measures real-world readiness? A. Written multiple choice tests. Simulated live dictation exercises. Attendance logs. D. Peer observation sheets. 27. A compliant transcription training program must ensure which regulatory principle? A. Access to confidential data for learning purposes. B. Secure handling and encryption of all audio and text files. C. Open sharing of transcription files for practice. D. Informal evaluations only. 28. During mentoring, which question technique encourages reflection and self-assessment? A. Why do you think this edit is more accurate? B. Can you memorize this format exactly? C. Did you finish the report? D. Can you copy this correction directly? 29. What type of listening skill is most crucial for transcription accuracy? A. Passive hearing. B. Active listening with contextual understanding. Multitasking during playback. D. Predictive guessing. 30. Which element ensures consistency in formatting and style across transcription teams? A. Individual preference. B. Style-guide adherence. Random edits. D. Verbal supervisor feedback. 31. What is the best mentoring approach for an advanced learner struggling with attention to detail? A. Provide challenging dictations that demand precision. B. Reduce workload to minimize stress. C. Focus solely on speed. D. Avoid feedback to promote independence. 32. Which evaluation feedback style best aligns with adult learning principles? A. Judgmental and corrective tone. B. Reflective, goal-oriented discussion. C. One-way instructor criticism. Generic praise. 33. When creating a transcription training curriculum, which component ensures measurable learning outcomes? A. Clearly defined performance objectives. B. Instructor preference for content order. C. Unstructured daily dictations. D. Flexible but unassessed learning paths. 34. Which report type documents findings from diagnostic imaging procedures? A. Discharge summary. B. Radiology report. C. Operative note. D. History and physical. 35. A CMT must flag inconsistencies between dictated data and patient chart details. This process is called A. Blanking. Verification. Querying. D. Formatting.